I'm Kelly Warner. It's estimated that at least 30 million women and men in the U.S. suffer from an eating disorder at some point in their lives. More than 2 million are children between the ages of 13 to 18. For children and teens whose bodies are still developing, eating disorders can cause serious health problems. As a pediatrician for more than 25 years, Dr. Pilar Bradshaw says food issues are common in adolescence.
There are up to 40%, we think, of girls, but also boys, will pass through phases of weird eating during middle and high school. And the real question is, when does it get to a point where a parent needs to be worried?
There are three main types of eating disorders. Anorexia. A child refuses to eat adequate calories out of an intense fear of becoming fat. Bulimia. A child grossly overeats, often referred to as binging, and then purges the food by vomiting or using laxatives to prevent weight gain. And there's binge eating, when a child gorges on food but without purging.
It's becoming more and more diagnosed, and I do think it's more common.
As a pediatric nutritionist, Patty Fahlstrom specializes in helping children and teens with eating disorders. She says there are signs parents should watch for.
Have their eating habits drastically changed, in the last couple weeks or a month? Have they suddenly stopped eating things that they absolutely loved their entire life?
In addition to restricting food, is your child withdrawn, irritable, depressed, or acting odd? Do you notice they don't want to eat with the family or go out to restaurants? Do they take food to their rooms when that's not a usual pattern for them? Do they eat volumes of food and then disappear quickly after a meal?
Eating disorders are not primarily about food. There are complex factors like body image and unhappiness with other parts of their life that they don't feel in control of, so they take control of how they're eating.
If you notice unusual behaviors around food, get them into your pediatrician quickly, because the faster that we can get on top of an eating disorder potential, the better their chances are of full recovery.
To overcome an eating disorder, treatment is needed, not only to help restore normal weight and eating habits, but to address underlying psychological issues causing the disorder. The best results occur when eating disorders are treated at the earliest stages. I'm Kelly Warner.